to this discussion now. The Democratic Alliance in Gauteng says more than 30 hospitals and 83 clinics are without phone lines, allegedly due to unpaid bills by the Provincial Health Department. Charlotte Maxege, Steve Bigo and Ves copies are among the facilities allegedly affected. Let's discuss this now with the Gauteng Health spokesperson, Motalatale Modiba. Mr. Modiba, good evening to you and thank you for your time. Are phone services cut off from the health facilities I've just mentioned above?
Let me just maybe set the record straight to say it's not the number that has been stated is incorrect. The number that was communicated in February on the 26th. As we speak, you and I, and yesterday we issued a statement on this to say it's only 11 facilities that are affected. The facilities you have mentioned, they are part of the facilities that are affected. And the reason for this is because of a dispute that we have with our service provider, being Telkom in this particular instance, where as a department, we queried some of the items that were on our bill, where you would have facilities that appear on our bill, which we cannot account for because they're not part of our portfolio as the Gauteng Department of Health. Now, the approach that the service provider has taken is that pay and then we can negotiate after you've paid and so forth. We have, in the interest of obviously easing the inconvenience for the public, as you and I speak, we have paid whatever that was due on their side so that we then continue with the engagement around sorting out some of the items on the bill that we disagree with.
So that's very interesting. So you're saying that these facilities that are affected, they are not part of your portfolio, and therefore you cannot take responsibility for those telephone bills. Who do they belong under then, if they don't belong under Gauteng?
Yeah, what I think is that in the bill that they've given us, when you get your cell phone bill monthly, on a monthly basis, you can actually look at the item because it comes itemized. You're able to look at the items that are indicated. In our case, we're saying the bill that we have, the invoice that we had facilities, some other facilities for other institutions that have nothing to do with health facilities, and they're lumped together. And we were saying, let's separate those from our bill because we don't have a problem with paying. That's why in the past, when we were communicating this, we did indicate that we had made 2 payments on the 19th of February, and the other one we made it during the week of the 26th of February, just because the issue is not about us not being able to pay. It was us querying some of the items that were on the bill to say we cannot just be paying simply because we are being given a particular bill without questioning some of the items that are on the bill. But obviously, we've come into a particular agreement with the service provider, and as you and I speak, yesterday we made the payment. Obviously, from their side, they have to verify that particular payment, but it can clear from their side. But the issue around some of these items that were on our bill, that issue still stands, and we're still obviously pursuing that so that we can then be able to separate those particular issues, because we cannot be paying for facilities that we don't have on our list in terms of facilities that we are responsible for, and that is where the bone of contention was. It was not a situation of saying the department has no interest in paying. I mean, we do understand that they are a company; they also have to survive, and we owe it to be able to pay for services that have been received on our side.
Yeah, are you able to tell us what some of those items are that you're simply refusing to pay for on that itemized bill?
Look, some of the items would be other institutions. With many of the facilities that we have, it's common that you would have a facility that is within the same complex or within the same vicinity. Sometimes a mistake happens where you get that facility gets to be built under your name, but it's not actually your bill. The same way you would get a wrong mail and so forth. But I don't think we're in the position to where we want to then name those particular facilities publicly. But that is the where the bottom issue is in terms of the dispute that we've had with the service provider. But I mean, as government, we've taken a view as well in terms of saying part of going forward is to also look for alternatives that are much more cost effective insofar as the issue of communication between facilities and communication between facilities and the public. And that's why already some of our facilities, as we speak, we have migrated them into a new system that is called the Gauteng Provincial Voice Network System, which is operated by eGov, because I think it will drastically help us to reduce costs, but it will also ensure that we don't have this kind of issue. That's why in some of the districts, we did not have a single facility that was affected because they've already been migrated into the new system.
All right. So when telephone lines are cut off, is the understanding that people who are looking for emergency services, an ambulance, for example, are not able to call these hospitals because the phone lines are simply shut? Is that the understanding? Do I have it correct?
No, that's not correct. When you are in distress, you don't call a hospital for emergency services. You call the Gauteng Emergency Services line, which is a completely separate line from the lines of the hospitals. The ambulance, once it comes to you, it is the ambulance that will make arrangements with a particular facility. Now, internally, we don't have a problem with facilities talking to each other because obviously we've made provision for alternative numbers, which we have seen they are published on the Gauteng Provincial Government site. The public, when you go there on under Gauteng.gov.za, the first thing that you see that pops up at you is that flashes the first that is those numbers. And when you click there, you will be able to see the contact numbers of all these facilities. But it does not affect issues of patients admission at our facilities because you don't book yourself directly at a particular hospital. You actually, if you're in an emergency, would call an ambulance, and that ambulance will be the one that makes arrangements. The only thing that maybe would have inconvenienced the public would be if my uncle, my brother is at the hospital, then maybe I want to check up on them. Obviously, there would have been that inconvenience. But we've since mitigated on that in terms of availing the alternative numbers for these 11 affected facilities.
And how were those numbers shared with the public, those alternative numbers?
We have utilized various platforms. One, the primary and most effective one is obviously putting them on the website because there anyone can be able to go in and download those particular numbers. But we've used various means, including social media platforms that we have for the different facilities and even the ones that were operating at the central office level. We've also circulated those numbers on community groups via WhatsApp because we've just put them into one form so that it's easier for us to circulate them. So we've tried various means in terms of distributing those numbers. We do consider that there would be some people, for example, that maybe might not have seen those numbers, or they because not everyone just to see even this interview. Some people then will know where to get these numbers, but others might not at this moment be tuned into this particular platform,
exactly.
And they might still maybe be sure as to how to get those particular numbers. But the quickest way now, obviously, is to utilize multimedia platforms. We've shared these numbers with various media houses. Some of them I've seen they've already shared them on their platforms, even the links in terms of where people can be able to get access to these particular numbers. But we're expecting that this issue by next week would be resolved because we've already made the payment that the service provider was looking for. The only thing is that it takes 5 working days on their side for everything to clear. And obviously, with tomorrow being a public holiday, we're expecting that anytime between Monday, Tuesday, the payment should have cleared on their side, and therefore the lines will be back online.
Mr. Modiba, I think you have summed up what is supposed to be a last question, and that is people may not have access to internet. Some people may not even be able to watch this platform. And yet those are the same people that are expected to pick up these alternative numbers. The question I want to ask of you is, was that responsible behavior on the part of the department to simply not pay because you are disputing a particular item on your phone bill when you could have settled that with the service provider and that service provider pays you back what you are claiming you are billed incorrectly for? Was it responsible behavior on your part to simply not pay the telephone bill?
I suppose, colleague, the matter is debatable, and obviously we have to be sensitive to the fact that there are people that are inconvenienced by this particular arrangement and so forth. But obviously we have a duty to ensure that as we pay for services, we pay for what is owed. Because if we go with that logic, often we've had service providers coming and claiming huge amounts, and when you go back, it's not as easy to claim back sometimes when you've released huge amounts to the other side. So it's always safer to safeguard and try and negotiate so that you are able to find each other. At times, unfortunately, like in this kind of a situation, things don't go the way you want them to go. But the intention is not necessarily to inconvenience the public. We are conscious of the fact that it is distressing to have a loved one who's at a facility and you're not able to maybe reach them to check on them and so forth. But at the same time, we have a burden to also ensure that we are often held to account of funds that we cannot properly account for and so forth. And so it's one of those situations where you have to balance, in terms of accountability, but at the same time creating a situation where the public has got easy access in terms of being able to communicate with our facilities. And we do consider that I think we would want to handle this type of situations much more better. And hence we are exploring other systems that we think that will ensure that the public does not experience this type of inconveniences as we go forward.
All right. Motalatale Modiba, let me thank you very much for your time. Spokesperson for the Gauteng Department of Health.